We've done this for 4 years to pay tribute to military people and their families and to other people who've suffered traumas and adversity, like people dealing with physical and sexual abuse. This is my colleague, Dr. Guskonsky at SUNY Fredonia. He has been very helpful in coordinating and helping gain funding for this. But most importantly is the guest speaker, Dr. Carl Fromm, who is a clinical psychologist at the Buffalo VA. He will tell you he wears many hats with different kinds of pain specialty committees, so he'll be better able to do that than myself. But the reason he's here is because of his humanity. When I had a client who was suffering grave pain and depression and suicidal ideation, he took the time with us on the telephone. So I felt that that was an indicator of, the character behind the wisdom. And that's why he's here. And also, if all goes well, we are going to hopefully show this on our local public access TV channel and on YouTube. And I guess that looks like it's YouTube/manage pain. And that is one word, manage pain. So hopefully we're small in number tonight, but other people that you may inform about the program may benefit from this at some point in time. Pain is a serious situation and affects most of us at some point in life, and if there's any way we can have a greater sense of choice and hope, then that's what we're hoping this program will accomplish. And so we're grateful that you're here, and so I guess you will tell us whatever you like and then address questions.
Okay, thank you.
We need to know.
Yes, good. From our experience this afternoon, the time went very, very quickly, so I'm going to race past some things. Let me, a little bit of an introduction to me very briefly. I'm a clinical psychologist, as Dr. Benabato said, dually trained in physiological psychology. The main things I want you to get is I'm a behavioral medicine specialist working in chronic pain at the Buffalo VA, but I'm also part of national and regional efforts to improve what the VA system is doing around pain management. So if folks have questions about that, that's an interesting story. That's not all I do. I'm also the director of training for our program, and I do other things outside of chronic pain. Let's leave that. And, okay. One of the things missing in this, okay, I got to tell you this part. Since this evening session was designed to talk a little bit about family issues and military families, I'll go there as a priority. I think what I want to do is just hit on some very fundamental ideas about understanding chronic pain, and then we'll go talk about relationship issues and a little bit about, not so much about, I don't have much to tell you about chronic pain as it affects military families because we don't see them as being radically different, or there hasn't been a huge paradigm of study. But I'll tell you, give you a quick sketch of the current picture that we have of the veterans coming back from Iraq and Afghanistan and some of the issues that our system is facing. Otherwise, and I'm sorry because of our audiovisual issues, I can't show you this menu, but I came packing a slideshow of almost 200 slides of a bunch of different things. We can go anywhere. So if you have questions, we can talk about different pain treatment strategies, about pain medications, about issues specific to opioid medications, which is almost always a hot topic, particularly for clinicians. If you can stand it, we can talk about pain anatomy and physiology a little bit. Let's see, awareness and movement is an interesting exercise class that we've done at our hospital, a little bit about that. We have some more database things about family and culture, and coping variables. So I'll drag you through some of these fundamental things and then bring you in and please flag me down anywhere along the way, and I would much rather respond to your questions than drag you through this. Anybody wants to hear about right from the get-go?
Yeah, what were the things you listed about yourself?
Setting up? Okay. Not a whole lot different from what Sandy said. My training, I'm sort of unusually trained. I'm dually trained as a clinical and physiological psychologist, so that I've worked in behavioral medicine for my whole career with diabetes, cancer, on and on, coronary heart disease, and so forth. But the rest is just an elaboration of what you've been told. I've been at the VA since '93. I'm the chair of some committees that are trying to affect improvements in what our local system is doing around pain. But also, very exciting that, I think the VA system is at least on par with the private system right now, which is a sad statement, but in terms of what we're doing about pain management, we need to improve dramatically. And there are some huge things happening right now that I hope in 5 or 10 years will make our system much better at pain management. Again, locally, we're a bit ahead of that curve. Anyway, and that's it. And then I have other roles within psychology. I'm the lead psychologist and director of training. So if folks had questions about what do psychologists do in the VA system, we might go there. Okay? Okay. So I'm just going to touch on 2 important bits about pain. The most important thing is acute pain. You know, the main function of pain is it's an alarm system. It's a survival mechanism that is hardwired, and pretty much hardwired in most of these domains. Its purpose is to spare us from further injury. It says, get your hand off the burner dummy, you're hurting yourself. And so we have an automatic, emotional, physiologic response, meaning the autonomic nervous system gets jacked up, motor reflexes. Now, again, the cognitive part isn't so much hardwired, but certainly our learning history, our family values, cultural expectations have a huge impact on how we understand pain, how we understand our bodies. But anyway, acute pain is an alarm system, and it's meant to evoke this intense response. Something is dreadfully wrong, I need to do something about that. Chronic pain, I'll elaborate while this is building, but not at great length. That attitude pervades our culture and pervades medicine. You go to an emergency room, it's interesting, we have discussions with our emergency department providers. Even if we have folks who are kind of marginal characters who are not adhering to their pain treatment regimen in other clinics, when they come to the emergency department, if they present with out-of-control pain, they're going to get that pain relief. They're going to get that treated. You know, that's sort of a medical emergency. So much of what we see in medical products being marketed and in our culture kind of reinforces that. So I've just shown some images from the internet here. A lot of products promise us complete relief. You know, make pain go away. Take the pain out of your life. There are a lot of technologies that don't really have data behind them, but that people will invest in, hoping to be absolutely pain-free.
May I ask a question?
Yeah, please.
When you say the word pain, you're approaching it from the physical, mental, and emotional standpoint, not just physical.
Yes, sort of, in the sense, I have an issue with folks who will talk about emotional pain, meaning anxiety, grief, and I'm not talking about that, but I mean, right, the experience, the subjective experience that any of us would label as pain has these physical, emotional, psychological components.
Thank you.
Okay, but here we get back to my main point. Chronic pain is different. Chronic pain is a false alarm. Chronic pain, by definition, is pain that persists after your body has repaired itself and has healed as much as it's going to. And typically, if I have chronic pain, so now I'm living with some degree of pain that doesn't mean I'm harming myself, and yet it evokes all those same responses. And just understanding that alarm meaning that pain has, explains a ton about how we get ourselves into, not how we get ourselves into trouble, about the issues that we're grappling with. Certainly one of the main challenges, I guess, to folks living with chronic pain is switching over from, oh my God, something's dreadfully wrong, somebody has to fix this, somebody has to rescue me. And I've literally had folks say, I've been to 6 medical providers who all told me the same thing, but I'm looking for the 7th who will diagnose it correctly and tell me what it's going to take to fix my pain. So there's this transition that we hope to help happen and helping people see, no, it's not an alarm. You're not out of control. It can have a huge impact on your life, But your goal now is to manage the pain, to relieve the pain as much as possible, and then steal back control over all the other things that the pain has interfered with in your life.